Welcome to Fallopian Files, the visual podcast about all things woman for all womankind. I'm your host, Christian C. Today, we're going to be diving into a conversation talking about a topic that affects so many women, especially women of color. We're going to talk about uterine fibroids. So hopefully after this discussion, you'll leave with more knowledge and information so that you can take this back to your providers to ask questions and figure out for your care. So first, I want to talk about what exactly are uterine fibroids. You hear the term so much, but understanding exactly what they are is very important and key when you're advocating for your own health. So when we're talking about uterine fibroids, what we're talking about is what's considered an abnormal growth of the uterine cells that make up your uterus. So we're talking about muscle tissue for the most part, because the uterus is made up primarily of smooth muscle. And when you have fibroids, you have these little growths of sometimes fibrous tissue or muscular tissue that is growing abnormally from what your normal uterus would be. These fibroids can be internal. They'll be internal to the uterus where they're actually protruding into the uterine cavity. They could be in the uterine wall itself, in the wall or the musculature of the uterine wall, or they could also be outside of the uterus, sitting and growing more externally, where you're feeling or possibly having more symptoms in your abdomen as opposed to dealing with your reproductive system. So when we think about the definition, according to sources like the Mayo Clinic, they want to definitely let you know that uterine fibroids typically are non-cancerous, so they're not cancerous, but you do need to have biopsies done if you do have fibroids removed, just to ensure that they are not cancerous, that any growth is not cancer. But if you are diagnosed with uterine fibroids, they are typically a benign or non-cancerous growth within the uterus itself. And so a lot of women end up developing uterine fibroids typically between their 30s, early 30s and 40s. Also, if they're in their reproductive ages and you've not had any children yet or not given birth yet, or if you began to have your period very young, usually around the age of 10 or younger. If you started your period, you tend to be at a higher risk for developing uterine fibroids. And then also, if you are African American or have African ancestry in terms of descent, we tend to have higher rates of uterine fibroids than our non-Black counterparts. So most Black women, roughly about 80% of Black women, the statistics show right now, will experience uterine fibroids before the age of 50, which is higher than compared to our white counterparts who might not experience at the same rate, but roughly about 70% can expect to have or develop uterine fibroids before 50. The difference, even though it might sound like that's very close in terms of statistics, if we're talking about 70% versus 80%, the difference is that most African American women tend to have more symptomatic fibroids. So your fibroids cause more issues in your reproductive system, like abnormal bleeding, pain during sex, or even just if you're feeling more pressure in your pelvic area or in your lower abdomen. And they tend to grow a little faster and a little larger in African American women versus our non-Black counterparts. So it is very important to know kind of what you're feeling, what your symptoms are, and to be connected with a gynecologist or a specialist who can help you in the process of determining if you are actually having uterine fibroids and if they are the cause of symptoms that you're having and how best to treat it. So let me tell you a little bit about my journey with uterine fibroids. So I found out that I personally had uterine fibroids. It's probably been about 6 or 7 years ago. At the time, I had an IUD in place, and I was thinking about toying with the idea of trying to get pregnant with my then partner. And so I see a gynecologist regularly, which is very important. If you do not have a gynecologist, to try to find a way to get yourself connected with one. Many women will sometimes not seek a gynecologist that they see regularly, but instead will go to maybe clinics or urgent care when they're feeling symptoms of different things related to their reproductive system. But it's very important to have a physician or another provider, like a nurse practitioner or a PA, who specialize in gynecologic care that you see very regularly, so that you can stay on top of your uterine health, the health of your ovaries, your fallopian tubes, your pelvic floor, your pelvic area, and they can assist you in monitoring everything as you go. So I really, really advocate, if you do not already have a gynecologist, to be connected with one. But because I was interested in having a family, I decided to see my gynecologist and find out, how is my IUD? Is it in the correct place still? Is it something that, depending on how long I've had it, should I have it removed? When should I have it removed? If I'm thinking about having children, and how long will it take for the hormones to start to come out of my body for that process? So that's why I went into the office, and we started out with a pelvic ultrasound. So many women will have ultrasounds done for various reasons. It could be something like myself, trying to find out the placement of my IUD. It could be if you are experiencing symptoms, like I said, if you're having pain during your intercourse, or if you're having, let's say, frequent or urgent urination, or even difficulty with urinating, or if you're having abnormal uterine bleeding, which tends to be the most significant reason that people go to the gynecologist to be evaluated, is if they have abnormal bleeding outside of your regularly monthly period. And so typically for fibroids or things of that nature, as they're growing, if you don't have symptoms, they're not screening for it. So in an instance of having the ultrasound is when most people will find out. So it's kind of what's called like an incidental finding. So that's what happened in my case. We went in to look and see, from a vaginal approach, if my IUD was in the correct place. And at that time, we were able to visualize that I had started to develop some fibroids in the wall of my uterus. So we took pictures, we discussed between myself and the gynecologist, what did that mean? How large were they? Could they potentially impact me getting pregnant? And we decided at that time to kind of do more of like a watch and wait situation. They weren't very large. I wasn't having any symptoms. My periods were not abnormal, and I wasn't having any pain or pressure. So we decided to just kind of watch and wait, especially as I wasn't sure yet if I was ready to remove the IUD. So as time had gone on, I did notice that I started to have, in fact, symptoms over time. I did start to have a lot of pain during intercourse with my partner that I had not had previously. So I went back to my gynecologist. We repeated the ultrasound, and we found that my fibroids had grown, and they had grown fairly quickly in terms of size. They had pretty much, one had almost doubled in size within a short period of time, within about a year or so. And where it was located in my uterus, it was starting to protrude into that uterine cavity, which could potentially cause a block or barrier of my fallopian tubes once I was trying to get pregnant. So I was referred to a gynecologic surgeon, so a gynecologist who ended up doing additional training and surgery and specialized in that area. And we decided to go in to do what's called a myomectomy. So myo meaning muscle, essentially, and the ectomy part is removal. So removal of that collection of muscle tissue in the uterus that is the fibroid. So we were going to do that, and at the same time, she was going to take out my IUD, make sure everything was good. So had to set up a whole separate appointment to go through surgery workup, where you're having your labs drawn, you're having a lot of additional imaging done, and EKGs to make sure that your heart is good, especially if you're going to have to go under anesthesia at any time. They really want you to have that whole workup done. So went through that process, had surgery, and they were able to remove my IUD successfully, and they removed, I believe it ended up being 4 fibroids, if I'm correct. The one that was much larger, which kind of protruded into the uterine cavity, was the one they definitely wanted to make sure they cut down and shaved down internally, and then a few more that were external that were a little larger in size. So it's really important to think about. I just want to give a caveat when we're talking about surgery, that anytime you're cutting into tissue, you're creating more of like a weaker point in the body where it's going to heal back up. You'll create some scar tissue to heal back up in that place. But the wall now of my uterus is like a little bit weaker than it was previous because they had to go in and cut that out. Why is that important? Well, it's important because when I'm thinking about now going through the process of fertility treatments, which we've discussed before, and you guys are gonna follow me along with that journey. But when I'm thinking about the process of having children, now the doctors have definitely made it clear that I need to be open to the idea of having a C-section versus a natural vaginal birth, because of how much they had to cut out from the uterine wall to remove that fibroid, and that creating a weak point. The purpose, as we discussed previously about the uterus being made up mostly of muscle, you need that muscle to squeeze, contract, to push out the baby when you're having a vaginal birth. And that those contractions, as most women who've experienced them can tell you, are quite strong, and that's why you feel such pain with that, essentially that cramping. But having a weak point in the wall now means I'm at increased risk for rupture, or for that wall kind of breaking open and creating a medical emergency. So is definitely something to take into account when you're thinking about the treatment for fibroids in terms of what the risks versus rewards would be for each type of treatment. For me, because of how that fibroid was starting to protrude into the cavity, it was going to make it very difficult for me to be able to get pregnant later. So for me, the risk of potentially having to do a C-section instead of vaginal birth was worth it for me to be able to conceive and have a child in the first place. But for women who either are not looking to have children or have already had children and are not looking to have more, then that's something to consider when you are in the process of talking about how to treat things like your uterine fibroids. So after the surgery, I went through different stages of the healing process. So they had to leave basically a little balloon inside my uterus that's like a little mini catheter inside the uterus, just to make sure that as the uterus was healing, the scar tissue wouldn't cause my uterus to basically heal and close itself off. So the little balloon stayed in there for I think it was about a week or two. And then I had to go back to the surgeon for them to check and undergo what's called an HSG, or hysterosalpingogram. I know it's a big word, but the hystero for uterus, the salpingo, meaning it's looking at your fallopian tubes, and just visualizing that everything is open, no additional scar tissue, and nothing closed off because the body heals itself with the scar tissue. And a lot of times the body's not picking and choosing where it's going to grow it. It just knows an injury occurred and we need to heal. So we went back in. I had to do the HSG where they put the fluid into the uterus and the fallopian tubes to make sure that they were still open. And they found that I did have a little bit of scarring inside the uterus. So I had to end up going back to the OR. Not the same time. I had to schedule a different time to go back in for them to do a DNC, or basically to clean out the inside of my uterus and essentially surgically scrape out that inner lining so that it can grow back and heal without the scar tissue. And so we went back in for that procedure, had to do a repeat HSG again after, and I'm happy to report now that they said my uterus is optimal for pregnancy. So now, after going through that whole process, I'm able to continue. I continue to have my uterus checked when I go to the gynecologist. We do ultrasounds each time just to make sure it doesn't look like additional fibroids are growing or any small ones that were left behind are getting any bigger. And also to ensure that my uterine cavity is still open. So, just to share a little bit about what my journey was, and next I'd like to just kind of give you a little more background of the kind of scientific information that is out there. So, when we're talking about uterine fibroids, a lot of people want to know, how did I get this? How did it happen? What is the cause? And unfortunately, when we're talking about fibroids, I have to say it is still so much that is unknown about the cause in terms of why they develop, or how they develop initially. There are many factors that, or risk factors that many researchers, scientists, physicians will let you know that if you have certain factors, you're at a higher risk for developing the fibroids. So some of those I mentioned earlier, where if you are African American, if you have a family history of fibroids, if you started your period around the age of 10 or earlier, and also some environmental factors where if you do have fibroids, then if you have too much, let's say, because they always want you to have a balanced diet. So if you consume too much meat, like red meat, or too much alcohol, wine, beer, these are factors that impact the growth of fibroids that can cause, if you have fibroids, for them to possibly grow a little larger. And then also hormonal impacts as well. So if it's definitely important, if you're going to the gynecologist, they will have you do labs to check your hormone levels. And a lot of research has shown that our progesterone levels and estrogen levels have an impact on fibroids, sometimes causing them to grow larger, or as you reach menopause, then eventually the lack of those hormones in your system theoretically should cause fibroids to begin to shrink as well. So sometimes you'll notice that the treatment for fibroids is not always surgery. It could be medication. Something like an IUD sometimes is suggested, the hormonal IUDs, because those hormones can impact and lessen the growth of the fibroid as well. So there's still a lot of research that needs to be done in terms of how fibroids are developing initially, like the causal relationship of how fibroids are developed. So that's an area we need more research. We need more funding. We need to continually advocate for that area of women's health to be looked at further, because so many people are impacted. Like we said, for you to have 80% or 70% of women to be impacted by uterine fibroids before the age of 50 or by the age of 50, that should tell you something, that this is something that really needs to be widely looked at. And the fact that it is so prevalent and we don't screen for it, we don't give people the information on how to potentially lower their risk, or if they already have the fibroids, how to become more comfortable or reduce the type of symptoms that they're having. It lets you know that this is an area where we really, really need to grow. So that's just one area as well that we're talking about. Also, wanting to make sure, as we talk about in terms of diet, not just that your diet is high in red meats or in alcohol, wine, or beer, but also if you're lacking vitamin D. This is shown to be an area that also impacts fibroid growth. And most African Americans are actually vitamin D deficient. So if you're not seeing a physician and having your lab levels checked, that's something to look at. Most of us do need to take vitamin D supplements. It impacts so much in terms of your body, your immune system, but also in terms of making sure that you have proper uterine health as well. And then also talking about fibroids and its impact with fertility. So I shared with you my journey and how the placement of where my fibroid was, that it was impeding in that uterine cavity and could potentially block from sperm being able to get in and actually fertilize the egg. Well, there's other risks as well when you have fibroids, if you don't have them removed or treated before pregnancy, where their placement or their size could impact the growth of the embryo, and can also result in more frequent pregnancy loss. So it's definitely important when you're thinking about your fertility journey and trying to have children, to have the health of your uterus checked out. Every time you go in to have your gynecology appointment, you may not be having a pap smear every time, remember, because those are every 3 to 5 years. But you could go annually for a pelvic exam just to make sure that the size, shape, and health of your uterus, ovaries, and fallopian tubes are in good health. That's something you really should try and do annually, even though you're not getting a pap smear every time you go in. Some other complications that have happened with uterine fibroids in terms of pregnancy, you're at a higher risk for what's called placental abruption. And that's when the placenta, which is what basically houses your baby, it's what filters the blood to bring nutrients in and waste out as your baby is growing, where that placenta can start to pull away from the uterine wall. When it does that, it's basically creating an open wound inside your uterus that could potentially bleed and have many, many repercussions due to that. Not only for potential loss of the pregnancy, but lots of medical emergencies that could occur from you bleeding basically unchecked internally. So having fibroids, because it is creating a part of your uterine wall that's unstable, that where the placenta can't attach appropriately, can increase your risk for this. Also, depending on the size of the uterus and the size of the fibroid in the uterus, it can potentially restrict the growth of your baby, because that fibrous tissue in the fibroid itself, it's not going to be as pliable as the rest of the muscle in your uterus. So it's not going to be able to stretch and grow the way your uterus needs to stretch and grow to house your baby. So it can restrict fetal growth. And then also you would be at a higher risk of preterm labor, where you are potentially delivering your baby a lot earlier than what's expected or what would be deemed safe. So now you're talking about your baby potentially having to spend time in an ICU setting to develop further, where they would have had that time in your uterus to kind of grow and develop and be ready for birth. The fibroids can impact that greatly. So these are all reasons why we need to really advocate about continued research and funding going towards women's health, so that we can have more of a scientific knowledge and understanding, increase the ability to screen and be able to treat fibroids a lot earlier and not be as symptomatic and have much more invasive types of treatment. Luckily for me, in my situation with my surgery, I was able to do a laparoscopic procedure, or one where they just go in with a camera and smaller tools essentially to go in, and they can be more precise and pinpoint, remove those fibroids, and the turnaround and recovery time is much shorter. Unfortunately, for a lot of women, if you're not getting checked and you're not finding out that you have fibroids or treating them sooner, then the type of treatment that you receive could end up being more invasive, where they have to actually do an incision to open up your abdomen to get to the uterus to remove those fibroids, or even in extreme cases where they might recommend hysterectomy, meaning they are removing your uterus entirely. So it's definitely something that we want to make sure you are advocating. And please remember that if you are given these options and you have concerns, always continue to ask questions. It is your body and your health, and you need to be able to advocate for yourself, and to be there, because no one else is really going to advocate for you the way you are. And then also to understand that you have the right to get a second opinion. If you have a provider who jumps straight to hysterectomy, let's say, and you know that you want to have children eventually, it is not inappropriate or uncommon to seek a second opinion, just to find out from different perspectives, is this the ultimate treatment plan for you? Are there any other less invasive options that can help you spare your uterus to be able to preserve your fertility? These are all things that are well within your rights to do, that we need to continue to advocate for. It is not problematic to ask questions and to have healthy, skepticism on everything that is given to you. You don't have to just take one view. It is important to get multiple views, and then ultimately do your own research and make decisions that are best for you and what you want moving forward. So definitely, if you are someone who has experienced these types of symptoms, if you've had uterine fibroids, or any symptoms like, the pain during intercourse, abnormal uterine bleeding, where you're bleeding more, bleeding less, bleeding more frequently than what you would do on a monthly menstrual cycle, and any of these symptoms have disrupted your daily life, please do not ignore it. Keep a health journal. If you have, in your phones, most of us have notes apps. You can keep like a little weekly or daily journal, monthly, if you're not really having symptoms that often. Keep a monthly journal of your menstrual cycle to say how long has it been, that in terms of the length of your period, how heavy was the flow, did you have to use a lot of sanitary products on a month to month basis. For example, if you're a woman who needs to wear a tampon and a pad and you're still, concerned that you are going to bleed through all of that and you have to frequently change. Having heavy uterine bleeding like that is something that can not just impact your lifestyle in terms of what you're able to do, but it could impact your hemoglobin levels. So if you've ever been told that you are anemic, then that's something that having very heavy periods can impact. So making sure you have a provider who's following you and making sure they're keeping up with your labs, that's important. So we want to make sure that you're keeping track of that, because the more information you can provide about your own health, the better. And that gives more insight to these providers to be able to give the best choices for you. So having something like a health journal to track your symptoms is amazing. And don't be afraid to ask. First, everyone should have a primary care provider. Let me start with that, because I was about to go into something else. But having a primary care provider who monitors your whole health picture is important. Once you connect with a primary care provider, do not feel like you cannot ask to see a specialist. And your primary care provider can provide you with that type of referral. If you feel like things are abnormal and the treatments or the plan that you've gone on have not really taking care of the issue, then seeing someone who specializes in that type of care or who specializes in that type of disorder or symptom, whatever it is that you're going through, is going to help to give you even more choices in terms of treatment that could be beyond what a primary care provider could possibly offer you. So don't be afraid to reach out and ask to see a specialist and to seek a second opinion. And remember that advocacy does not always mean standing in front of a crowd and or sitting in front of a microphone and shouting or giving as much information as possible to, to the uterus, to the universe, or the uterus, whatever, all of the above. But it could also be in just sharing your story with other people, because sometimes just having those conversations amongst other women, amongst friends and family, you'll learn that not only are you not the only one going through what it is that you're going through, your story might help someone else decide, you know what, I have been feeling this, I have been experiencing this, and just kept it to myself because for me it was normal. And not knowing that, hey, maybe I should get this checked out. Maybe this is something that I can have an intervention that can potentially make things easier for me, make my period more normal, make my, the fact that I'm frequently running to the bathroom, maybe I don't have to do that. Like all those things that we've kind of seen for women just accept as normal part of life. A lot of times it doesn't have to be. And so sharing your experience, sharing those stories, that is advocacy as well. Because if we keep it to ourselves, we're not getting the information out there. And I feel like that's one of the things that we're missing a lot today, is that community aspect. We used to have communities of women who would talk. You would hear from, your elders about what they went through, what they how they dealt with it, what you can expect to come up in your life. Peers who are going through similar things and what they've done. We used to have those types of communities, and now we seem to be a lot more dispersed and kind of focusing on self. And so I want really to implore for each of you to really continue to build community, to continue to talk, share your story. This is advocacy. And the more that we talk and share our stories and share this information, then the stronger we are is a voice to say, hey, we need this research, we need this funding. Please help, women's health for us to grow and know how to care for our own bodies. So, like I said, Fallopian Files family, I really want to hear from you. So I want you to definitely get into this comment section. Let me know, what types of experiences have you had? If you suffer from uterine fibroids, what have you found that has helped alleviate your symptoms in the meantime while you're seeking treatment from professionals? What have you found that has made your symptoms worse or better? Let's have that conversation. I also want to hear from you all to know, what other types of topics would you like to hear about regarding women's health that you don't typically hear about? How can we continue to grow and build as a community? So making sure that you are sharing this episode with friends and family who you think could benefit from it, learn from it, and grow. So continue to share, comment. Please like and subscribe, because the more that you're able to see the content as it comes through, the better for you to be able to arm yourself with information as we are moving forward. And if you have experienced definitely the fibroid surgery, having myomectomy, or even having to have a hysterectomy if your fibroids got to that level, I really want to hear from you as well. Many women are afraid to have a surgical intervention and seek a lot of either medicinal from taking medication, or herbal types of intervention to try to reduce or remove fibroids. And it's understandable, because surgery is scary. It is definitely something that can be hard to know, that you're going to have to go under anesthesia or under the knife to treat your fibroids. And so many will choose not to, and will just continue to watch and wait. And I think these are all conversations that we need to have, so that either I went through this surgery and this is what I experienced, or I chose not to and this is my experience. Every decision that we make is going to have consequences, so nothing is going to be perfect. And there are risks and rewards to every decision. But having the information, being armed with the information that we need, is what is going to empower us all and really be the biggest advocacy that we're looking for. So thank you so much for spending time with me today. If this episode resonated with you, then please share it with a friend. Like I said, leave a comment, subscribe, help grow this community, the Fallopian Files community. And until the next time, please remember to take care of yourself, and remember that there's always power in community and education, and that's what we're building right here at Fallopian Files.